Hello, dear students. Today we are going to learn about some teratogenic drugs which causes fetal damage if taken during pregnancy or during conception. During the pregnancy, the first trimester or especially the first 3 weeks of gestation are very important, during which teratogenicity occurs due to the defect in the organogenesis process by the drug at that time. First, the very important drug thalidomide, which was used in Germany as a sleeping pill in 1950s. Then it also used as uh, in pregnant females as a drug which can prevent the morning sickness. But it was found that it is associated with teratogenic effects if taken especially in the 20 to 36 days, it is during the third to fifth weeks of gestation. The mechanism of its teratogenicity is by binding with the cereblon, and then this binding causes inhibits the inhibition of the angiogenesis and increase oxidative stress and causes the apoptosis of the limb bud mesenchyme, due to which there is defects in the limbs in the form of phocomelia, that is loss of proximal part of the limb, and the distal part of the limb attached directly to the body, amalia, that is the absence of limb, merumelia, that is the partial absence of the limb, like missing radius or missing ulna, micromelia, that is the reduction in the size or overall shortening of the limb segments, and other is the radial ray defects, which are the absence or hypoplastic radius or thumb. Other defects can be seen as craniofacial defects like microtia, that is a small ear, microphthalmia, that is a small eye, cleft lip, cleft palate, and cardiac septal defects. Thalidomide still used in cases like myeloma and autoimmune diseases as an immunomodulatory drug, but it must be avoided during pregnancy due to its teratogenic effects. Now come to the fetal hydantoin syndrome. It is caused by in utero exposure by phenytoin. If mother is taking the phenytoin, which is an anticonvulsant drug, and its use especially in the first trimester causes oxidative stress with folate antagonism. These both causes the disrupted cell signaling and impaired organogenesis, which again is the main feature of the first trimester pregnancy, and it leads to craniofacial defects, limb abnormalities, neurodevelopmental defects. Craniofacial defects include the microcephaly, that is small head size, hypertelorism, cleft lip, cleft palate, and low set ears. As we can see in this picture, the baby is having cleft lip and cleft palate. There is also the limb defect in the form of hypoplasia of nails and distal phalanges, and there is also the growth retardation like IUGR and developmental delay later in life, and also the intellectual disabilities. In this picture, there is only one uh, umbilical artery. So this is the fetal hydantoin syndrome. Now come to the fetal valproate syndrome. It is caused by the valproic acid exposure during the organogenesis period, that is during the first trimester of the pregnancy. Major effects include the neural tube defects. By inhibiting the folate, this causes the neural tube defect and facial dysmorphism, cleft palates and cleft lips, cardiac and skeletal anomalies. Neurodevelopmental delay can also be seen, and there is increased risk of autism. Mechanism is the HDAC inhibition, that is histone deacetylation inhibition and folate antagonism, which causes the impaired organogenesis. And to prevent this, folic acid should be taken during the pregnancy, at least 5 milligram per day, and it should be started since the preconception period and continued during the pregnancy. Now, this table is showing the unsafe anticonvulsant used in the pregnancy. First is valproic acid, which causes neural tube defect, autism, and facial cardiac anomalies, which is known as fetal valproate syndrome, as we have seen already. Phenytoin is a cause of fetal hydantoin syndrome. It is also causes teratogenicity, including the craniofacial limb and growth retardation. Then phenobarbital is also associated with the facial anomalies. Carbamazepine is also causes the neural tube defects, but less than valproate, and craniofacial defects also. Topiramate is also associated with the craniofacial defects like cleft lip and cleft palate and growth restriction. The anticonvulsants which are safer in pregnancy are lamotrigine and levetiracetam. So these drugs can be used during pregnancy, but it should be remember folic acid always be used with the use of anticonvulsants. Now the drug which is used in the bipolar disorder, and it is the lithium. It is associated with the Epstein anomaly, that is the tricuspid valve malformation, and the risk is highest during the first trimester. Other defects of the septum like atrial septal defect and the ventricular septal defect can also be seen. There is also a risk of nephrogenic diabetes insipidus. Other defects can be seen like floppy baby syndrome due to the fetal hypotonia, cyanosis, hypothyroidism, and renal impairment. Management includes the avoid the abrupt withdrawal of the lithium, because abrupt withdrawal can cause the risk of relapse in mother, and consider the dose reduction especially in the first trimester of pregnancy, and do the fetal echocardiography at 18 to 22 weeks of gestation and monitor the fetal heart function. Monitor lithium levels, TSH levels, and renal function throughout pregnancy. Now come to the antidepressants in pregnancy. Antidepressants all acts on the serotonin. They increase the level of serotonin in the neurosynapse, and this increase in the level of serotonin causes the antidepressant effects. But it is also important in the fetus that 5-HT, that is the serotonin, is required for the establishment of the left and right axis. The serotonin levels are more on the left side of the embryonic disc as compared to the right side, because of the ciliary movement of the primitive streak and primitive node. The ciliary movement causes the increased concentration of 5-HT on the left side, which causes the further development of the embryo in the proper manner. So any defect in this metabolism of the serotonin causes the situs inversus, dextrocardia, and heart defects. Sertraline is the preferred selective serotonin reuptake inhibitor for the both pregnancy and breastfeeding. Paroxetine should be avoided in the first trimester because of the cardiac risks like septal defects. Tricyclic antidepressants like nortriptyline and imipramine are generally considered safe alternatives. And monoamine oxidase inhibitors are avoided due to the potential hypertensive crisis and poor safety data available for them. Now come to the warfarin embryopathy. Warfarin is an anticoagulant which crosses the placenta and And thus, it inhibits the vitamin K dependent pathways, and which are the most important pathway for the development of the bone and cartilage in the fetus. So, the use of vitamin K antagonist or warfarin in the pregnancy, especially in the first trimester, causes the defective bone or cartilage development, which causes the nasal hypoplasia, stippled epiphysis. As we can see in this picture, there is punctate dots, white dots, small dots in the epiphyseal region of the femur, proximal femur, and there is a nasal hypoplasia. There is also the limb hypoplasia, growth retardation, and fetal hemorrhage. Which anticoagulant is safest in pregnancy? Heparin. Heparin is the safest anticoagulant during pregnancy. Now come to the fetal alcohol spectrum disorder. Ethanol crosses the placenta freely and causes the oxidative stress, apoptosis, and disrupt the neural crest migration, and retinoic acid signaling, which are very important for the organogenesis. Thus, it leads to defective organogenesis, especially if taken during the first trimester of pregnancy. There is no safe threshold to which alcohol can be used, and the damage to the fetus occur dependent on the dose and timing of the intake of the alcohol by the mother. And the first trimester is most crucial time, and it leads to the facial defects, especially which includes the smooth philtrum, that is the upper lip becomes smooth, there is no philtrum, the central portion is absent, and the thin upper lip, short palpebral fissures, microcephaly, intellectual disability. Alcohol is the most important and most common cause of the intellectual disability worldwide, and it is the most common preventable cause of the intellectual disability. And other features include growth retardation. Now come to the isotretinoin embryopathy. Isotretinoin is a retinoic acid agonist, that is vitamin A agonist, and it is extremely teratogenic, and it is contraindicated in pregnancy because it damages the neural crest cell migration, and it disrupts the retinoic acid signaling, which is the most important signaling during the organogenesis. Its use, even in the topical form, which are used for the acne, should be avoided. And the defects include microtia, anotia, cleft palate, flat nasal bridge. In this picture, we can see the microtia, small ear, flat nasal bridge. Cardiac defects include the tetralogy of Fallot, that is the conotruncal malformation, thymic hypoplasia. CNS defects include hydrocephalus, microcephaly, cerebellar malformation. Eye defect include the eye defects and intellectual disability. Its use is under strict eye pledge or REMS program, which is commonly used in USA for the risk evaluation and mitigation strategy to prevent the fetal exposure to isotretinoin. And it includes the female to take 2 forms of contraception for at least 1 month before, during, and after treatment, and have monthly negative pregnancy test before prescription refill. Prescriptions limited to 30-day supply, and no automatic refills should be given. And aim is to prevent severe teratogenic effects due to isotretinoin embryopathy. Now come to the antihypertensive like ACE inhibitor in pregnancy. ACE inhibitors like enalapril, lisinopril are contraindicated in the pregnancy because they disrupt the renin-angiotensin system and damages the renal tubular system of the fetus, which leads to oligohydramnios. First trimester defects can also damages the cardiac and CNS development. Second and third trimester use damages the renal tissue, so causes the renal failure, pulmonary hypoplasia due to the oligohydramnios, limb contractures, and fetal death. So this is the list showing the antihypertensive which are unsafe or contraindicated during pregnancy, like ACE inhibitor, angiotensin receptor blockers, aliskiren, thiazide diuretics, and beta blockers. Beta blockers causes fetal bradycardia. Thiazide diuretics reduce the placental perfusion. Aliskiren is teratogenic, and uh, ACE inhibitors act like the ARBs acts like the ACE inhibitors. So these drugs are contraindicated antihypertensive during pregnancy. The safest antihypertensive in pregnancy are LMNH, that is the labetalol, methyl-dopa, nifedipine, and hydralazine. Few other drugs which are contraindicated in pregnancy are the propylthiouracil, which is a anti-thyroid drug and causes goiter in the fetus and intellectual disability due to the hypothyroidism in fetus. Potassium iodide causes goiter and intellectual disabilities in the fetus. Streptomycin causes ototoxicity. Sulfonamides causes kernicterus. Tetracycline cause tooth discoloration and bone growth inhibition. Amphetamines causes oral clefts, cardiovascular anomalies. Quinine cause hearing loss. So this was all for today. Thank you.